Good morning, ladies and gentlemen. My talk today will be on the evolutionary theory of personality disorder. The evolutionary theory of personality disorder proposes that certain personality traits that were once adaptive in our evolutionary past can become maladaptive in modern society, leading to personality disorder. It proposes that personality disorder can be classified into three types based on the evolutionary origin of the maladaptive traits. 1. Anxious or avoidant type. This type is characterized by anxiety and fearfulness in social situations, which may have been adaptive in our evolutionary past to avoid danger and harm. Narcissistic type. This type is characterized by a grandiose sense of self-importance and a lack of empathy, which may have been adaptive in our evolutionary past to attract mates and resources. Antisocial type. This type is characterized by disregard for others' rights and a lack of remorse for their action, which may have been adaptive in our evolutionary past to compete for resources and protect ourselves. The symptoms of personality disorders vary based on the type, but generally include difficulty in social relationship, impulsivity, emotional dysregulation, and maladaptive coping strategies. Anxious or avoidant types may experience social anxiety, fear of abandonment, and social isolation. Narcissistic type may have a sense of entitlement, require excessive admiration, and lack of empathy for others. Antisocial types may have a disregard for law and social norms, engage in impulsive and risky behavior, and lack empathy for others. The treatment of personality disorder based on the evolutionary theory typically involves a combination of psychotherapy and medication. Psychotherapy may focus on developing adaptive coping strategies, improving social skills, and building resilience. Cognitive behavior therapy and dialectical behavior therapy have shown to be effective in treating personality disorder. Medication may also be used to manage symptoms such as anxiety, depression, and impulsivity. Antidepressant, antipsychotics, and mood stabilizers may all be prescribed depending on the specific symptoms and types of personality disorder. The evolutionary theory of personality disorder has both contribution and criticism. Contribution. The evolutionary theory of personality disorder offers a unique perspective on the origin of maladaptive personality traits, which can help clinicians better understanding and treat interpersonality disorder. 2. The theory suggests that personality traits that were once adaptive in our evolutionary past can become maladaptive in modern society, which can provide insight into the cause of personality disorders. 3. The typology of personality disorder proposed by the evolutionary theory provides a useful framework for counselors to identify and treat different types of personality disorder. 4. The evolutionary theory can help reduce stigma around personality disorder by suggesting that they are not simply a result of personal weakness, but rather a natural result of the evolutionary process. Criticism. 1. The evolutionary theory of personality disorder is difficult to test empirically, as it is based on hypothetical scenario that cannot be directly observed or tested. The theory does not account for environment and social factors that may contribute to the development of personality disorder, such as childhood experiences, trauma, and cultural experiences. Critics argue that the theory may be used to justify harmful behavior, such as aggression and domination, by suggesting that these behaviors are natural and adaptive. The theory may oversimplify complex human behavior and personality, as it assumes that all personality traits can be traced back to the evolutionary origin. In conclusion, the evolutionary theory of personality offers a unique perspective on the origin of maladaptive personality traits, but it has limitation and criticism. While the theory may not fully explain the development of personality disorders, it can provide valuable insights for counselors and researchers. It is important to consider both the contribution and criticism of this theory when assessing and treating individuals with personality disorders. Thank you for listening.